I'm Sean Smith. I'm a captain in the United States Air Force Reserves with the 934th Aeromedical Evacuation Squadron. So during the middle of June, myself and 4 other reservists and a 5-man team from active duty from Ramstein, Germany, went and participated in an exercise called Central Accord, which is an exercise in Central Africa. This year it was in Gabon, based out of Libreville and out of their airfield that they had there. What we did there was train approximately 26 individuals, about half from Gabon and half from Cameroon. The individuals from Gabon were mechanics and firefighters, and the individuals from Cameroon were doctors, nurses, and first responders and medics. Cameroon has a C-130 that they've purchased within the last few years, and what they're trying to build is an aeromedical evacuation with their military, where they can go out to the central part of Africa and all over Africa as well, to pick up their wounded soldiers and their troops, and also that of other nations. So what we were doing there was to train them on the different techniques that the Air Force uses in aeromedical evacuation, so they could hopefully implement that into their aeromedical evacuation, where they would start to build that, because it is currently just in its basic infancy of starting. So we showed them how they would set up their C-130s with the stanchions, with straps where they would all go, how it's set up, how it's secured, and then also some of the equipment that we brought were NATO litters, and then how they would utilize the NATO litters by putting the patients onto the litters themselves, securing them, and then bringing the litters into the aircraft. We also brought from my Minneapolis unit 2 C-130s, so we were able to show them how we set up all of our equipment and all of our stanchion straps, how we would set up our patients as well, just in the aircrafts that we use every day. Also, we taught them flight physiology, stresses of flight, and all the different body systems as well, like your cardiac, your musculoskeletal, any head injuries that they might have. One of their pilots showed us some video of the patients that they're going out and grabbing on the western side, into the western side of Africa, and it's what you would expect from a conflict. Machete wounds, lots of burns, gunshots, all sorts of battle-type injuries. A few of the other topics that we talked about is what we do in the United States Air Force in aeromedical evacuation. So we have 3 different primary aircrafts that we can fly on. We have a C-130 where that can hold around 70 patients, and that's my primary aircraft. If your stanchions and we're set up all the way down, straight down the center line of the aircraft, and then there's also side stanchions where you could set patients up as well. You could do about 70 patients. It would be a very full aircraft, and it'd be very crowded. And some of the types of patients that we care for is pretty much is the whole gamut. So obviously battle injuries, any type of humanitarian issues that might arise. So if you have your hurricanes, earthquakes, all sorts of injuries that come from that. Just recently we did assisted an ECMO team, and it was their first flight that they've ever done in an aircraft, where they did training with a simulated ECMO patient. Other patients that we can care for are patients who are ventilated. Sometimes we do bring specialized teams with those folks, and those are called CCAT teams, critical care air transport teams. And during my last deployment in Afghanistan, the majority of the patients that we did transport were battle injuries. Battle injuries consisting of gunshots, IEDs, blast injuries, and the likes of that. Basic crew complement is that of 5 people, 5 individuals, 2 of which are flight nurses, or 2 are nurses, and then the other 3 are flight technicians, or medics as we call them. The flight nurses on the reserve side come from every background that you could imagine. Some are administration, most are emergency, some are flight nurses on the civilian side as well, and the majority have a critical care background. Our medic side and the Air Force are certified to the EMT basic level. However, a lot of them are registered nurses, paramedics, LPNs on the outside world. Thanks for watching. My name is Sean Smith. I am a flight nurse with Midwest AeroCare here out of Chanute, Kansas.